Hello, lovely to see you. Oh, I've not even pressed the start recording button yet. Hello everyone, lovely to see you. Thank you very much for joining us. As usual, the COVID Champions meeting is being recorded. And as usual, if you're a bit shy about asking questions, please just pop something in the chat. You can always email us at any time with any questions. So here's the agenda for today. We've got the usual data update from Steve Turnbull, who's going to share his slides with us this week, a vaccine update, and that's going to be Sarah Ackers, updated guidance from our comms team, George Butler, Janet Watson from Livewell Wakefield will speak about long COVID and the services that Livewell Wakefield offers. Lisa Chandler will be joining us, but she's a bit late, so that's why I've tagged her on the bottom to talk about long COVID. And then we've just got a slide about gauging the mood of the community, where we'd like to invite you to give us your thoughts and feelings on that. So without further ado, over to you, Steve, and I'll stop recording, stop sharing my screen.
Okay, thanks, Tracy. Let me just share my screen instead. Let me just move it on to the right slide. So hopefully you should be able to see that now. So I'll just go through the usual data slides. There's a little bit of a smaller set than normal, but I'll explain why as we go through. So this is the familiar slide. This takes us back to November on the left through to the present day, and you can see the big Omicron spike and that descent downwards from the spike, which went over 3,000 per week, which is very, very high rates that we reached in Omicron. And we've come down really well, but I think as we talked about the last time we met, that's probably not truly reflective of what's happening in the community because of people's testing behaviour has been changing. But in the background to this, where we've always collected positive case rates, positive test numbers, the Office for National Statistics, the ONS, they've been doing a weekly survey. And what they do is they send out a random sample of tests to people, and then what they can do, not on a local geography, they can't do it for, say, Wakefield, but what they can see is people's level of infection, irrespective of their testing behaviour. So now the testing results are not as trustworthy. This is a good source of sense checking what's going on. And if you look at the bottom left here, you can see Yorkshire number, and we have decreased from 8% down to 3%, which is really, I mean, that's a really good reduction, and it's pretty standard. You can see it going down really well, which is good news. So that backs up that message that rates have come down. However, a couple of things to be cautious about. The level of 3%, that means 3% of people in Yorkshire number have tested are actually infectious at this point in time, and that would suggest that our rates of infection are actually a lot higher than what the previous slide has been showing. So we're probably not at the very lowest. It's probably come down and it's leveling off, but probably at a rate that is similar to what it was before Omicron came along. And you can see other parts of the country are doing similar. Northwest areas come down well, northeast area come down well, but actually there's some other parts of the country that we're not seeing this. So we're seeing the East Midlands being fairly flat, East of England fairly flat, and you can see at the top, the southeast is possibly starting to come back up a little bit. So it's still out there in different places. So we just need to be cautious on the numbers and not take them with a pinch of salt. And as of now, we've stopped doing our weekly briefing to elected members and published data simply because it's not as accurate as it was, and it might give the wrong message. But you can see in these slides, this is the level of positivity. So what percentage of tests come back positive and the number of tests being taken, they're coming down as well for Wakefield and for West Yorkshire and for England. So it's actually reasonably consistent messaging. And this is the heat map by ages, and you can just see the tail end of the Omicron wave over to the left. There's dark figures, and they've come down really well. So you can see on these official figures, all the age groups are coming down well, which is really positive. So that's all really good news. And as we know, when rates change, then a few weeks later, hospitalizations change. You can see that we're now starting to see a reduction in hospital attendances because of COVID. However, you can still see that there's still quite a number. So for Wakefield residents, there's still 24 people in hospital who are positive for COVID. So it's not gone away as we know. And what follows increase in admissions, of course, is deaths. And you can also see on this slide, over the last few weeks, we've started to see a reduction in the number of deaths. We're still having them, which is not to be forgotten, but they're certainly trending in the right direction, which is useful and very welcome. I won't talk in depth about vaccinations because Sarah's here to do a much better job than I have, so I'll move over that. But just note two things obviously on here. Lots of green, that's great, but actually there's still a lot of people not vaccinated and not taking up the boosters. So there's still work to do, as I'm sure nobody's surprised. That's it on that. I'm just going to add another slide. So I need to start sharing it. Oh no, I'm still sharing. Just bear with me 1 second. So I wanted to also show this slide. I want to show this slide, which it is, and this might be helpful to just to see what you think about this, and to think about this at the end of the meeting when we talk about gauging the mood of the community. This comes out of some work that Calderdale have been doing, and they've been sharing it with West Yorkshire colleagues. And what this is trying to say is what's our strategy from here on? What we're trying to achieve on COVID when we've now got the document living with COVID. All of the legal requirements have stopped. There's still guidance that we should follow, but it certainly feels a very different phase of the response to what it has done previously. And what these statements are trying to get across this next phase of the response, as hopefully we go back to some more normality. So you can see for individuals or particular settings, or your approach to vaccines, or people who are clinically high risk of COVID and health and care settings, you can see what those statements say. And this move to living with COVID has put a lot of people, could make a lot of people very worried, particularly people who are very vulnerable, clinically vulnerable to COVID. But these statements here, I think, are quite useful. So being clinically vulnerable, I am not afraid, and I think that's really important. It's really powerful statements. I can understand and manage my risk, and others understand why I'm doing this and support me in that. And I think these are really helpful. So I'd be really interested in hearing what people think of these words. But we can look at that possibly at the end of the meeting when we talk about the mood of the community. So that's just the extra slide I wanted to show. So I'll stop sharing now. Not sure whether there's been any questions in the chat.
No, I can't see any questions in the chat. We did have a question though, panel, from one of our members of the WhatsApp group, who asked for some advice. They're flying away on holiday in a couple of weeks' time and have just been told about testing, even though they've had the vaccine and the booster. And she was asking, is there anywhere in Wakefield to have this done, and which tests should we have? And she also mentioned that she needed to have wheelchair access as her daughter is disabled as well. And I think there'll be lots of people wanting to ask questions about going on holiday. So I wondered if the panel could perhaps respond. I know you can't respond personally to everybody's individual holiday questions, but maybe as a general rule of thumb.
Yeah, Sharpie, that's one of Tracy. I think in terms of information on holidays and going away, first, have a fantastic time. That sounds great. Holiday. In terms of testing, there are different providers, and there are a couple of things that I would recommend, and we'll put the information into the chat box if that's useful. We can share by email as well. The one website is the government website on the requirements that you will need to double check what you are required to have for the country that you are arriving at. And one of the things that I would highlight is that things do change quite regularly, and they can change quite quickly. So I would recommend checking the information on a regular basis. In terms of testing, I'll post a link to again a government website that has links that has information on the testing sites. You can narrow it down. You can have a look what places there are. In terms of testing, some areas also have testing kits that come to your home as well. So it's worth looking as to what your requirement is. Do you want to go to a testing site, or are you happy with having a test delivered to your house, and you can have a look? And that could help with the access if you don't actually want to be leaving the premises, or it can be a bit tricky. So I'll post it into the chat now. And when it comes to it, have a fantastic holiday, whoever you are.
Thank you, Darcy. I think we're all ready for a holiday, aren't we?
Sorry, Tracy, can I just add something in there on Darcia's very comprehensive review? Thanks, Darcia. I think the other thing, just to be cautious of whether it's needed a supervised or self-administered test as well for your end destination, because the home testing offer doesn't cover that. You actually physically have to go somewhere and have someone physically take the test and supervise that. So that's just a word of caution in the finer print to that detail as well.
That's really important. Thank you very much for that, Emma.
And if I can add something on vaccinations, I'm really pleased to see that you've had all of your vaccines and your booster, which is really, really important. If there's anybody that you know who is planning a holiday who maybe has got 1 or 2 doses that are still outstanding, really try to encourage them to get on and get those booked, or use a walk-in centre and get their vaccinations up to date. Because what we're finding is occasionally we're getting people who come a little bit too close to the time that they're going to go on holiday, and they're finding that they need to have had their vaccination perhaps at least 2 full weeks before they're flying. So we don't want anyone to not be able to go on holiday because they've just not got organised. So if you're aware of anyone who's got any outstanding doses, really encourage them to take up the offer and go and get vaccinated as soon as they can. Then they know that's not going to prevent them flying.
Sarah, it's Emma again, Tracy, sorry. Again, just from experience from traveling to Ireland, some countries are asking for boosters, so it's not enough to just have dose 1 and dose 2 as well. So for people not to get caught out with the booster requirement for certain traveling arrangements as well.
Fantastic, thank you. We've got a comment. Anne-Marie has been asked a couple of times this morning here at Pontefract Library if there will still be free lateral flow tests people can pick up from the likes of libraries when they're starting to be charged for. If not, will there be sites that will sell them? Good question, Anne-Marie.
Do you want me to pick that one up, Tracy? And Emma will correct me if I get something wrong. But from until the end of this month, so until the end of March, then LFTs will still be available free of charge. We don't know the full details of what it will look like in April and beyond. And the guidance will probably change as to when you need them, but we don't know that for certain yet. But there won't be. We don't yet have any plans to be able to pick them up free of charge, and we won't be able to do that from the 1st of April. But there will be places selling them. Probably some of the high street pharmacies will be selling them. Some of the costs that we have started to hear about is £5 for one test, which is not good. We're not fans of people being charged to access these tests, which can help people keep people safe if they're going into vulnerable settings or they want to visit somebody who's vulnerable. So unfortunately, that all that support is coming to an end. What we don't know is, for example, at the minute you need to take an LFT test to say visit somebody in a care home. Now we hope that will be available either free of charge or they'll drop that requirement at the end of this month, but we just don't know the detail on some of that yet. What we will try and do with we've got some stock left in the council anyway that we've been using as an assisted tested program. We'll continue to run that until the end of the month. any stock that we've got available, we won't be able to keep, but we will try and make sure that it's moved to places that can support people who will need to access them, particularly anybody who's more vulnerable. So we'll try and support care homes. We'll try and support voluntary groups. We'll try and move them into places where we can do the most benefit with them, but we won't be able to run a distribution system beyond the end of this month.
Thank you, Steve. I noticed Deborah had got a hand up. It's gone down now, but if you're there, Deborah, and you want to ask a question, please do. Can't hear anything. Maybe you can pop it in the chat or come back to us later.
Tracy, it's Emma. Can I just add something to Steve's discussion,
Yeah.
if that's okay? I think as well, it's helpful to remind ourselves that testing, as Steve said, is one aspect of sort of prevention messages and then supporting to people to sort of protect themselves against the virus. But we mustn't forget the other basic things like hand hygiene. You know, if you're feeling unwell, not to visit relatives. I suppose it's helpful also to understand the context of why you might require the kit. Hopefully there wouldn't be major sort of national requirements to test that wouldn't be sort of funded free of charge, which is some of what Steve talked about there. So I just think just to have this chance to think about the other messages, and vaccination plays into that as well, and the booster program plays into that, because that does offer you one of the best forms of protection against the virus, and the testing aspect is just an extra layer. Thank you.
Yeah, thank you, Emma. Thank you very much. So now we've got Sarah. If you'd like to present your slides, Sarah.
Good afternoon again, everyone. So I'm Sarah Akers and I work in the COVID vaccination programme team for Wakefield. I haven't got any slides which tell you how many people have taken up the vaccine in Wakefield, because it doesn't change very much at the moment, because we've actually done so incredibly well in Wakefield. We've delivered over 750,000 vaccinations for people who are residents in Wakefield and registered with the Wakefield GP. 750,000 is a lot of jabs, and that means that we've got really, really good population coverage. That's not to say that there aren't some people who are still outstanding some doses though. So what I'm going to talk about now is who's eligible at the moment to get their vaccination. And I think that this was also covered a couple of weeks ago, but it's probably useful to just recap on that. And then I'm going to talk a little bit about the programme going forward from April. So at the moment, basically, almost everybody who is over the age of 12 is already eligible to have a vaccination. People aged over 16 have been eligible now since August last year. So many 16-year-olds are falling due for their booster because they've had 2 doses and they're now able to have their booster. So they will have had 3 doses. We added in children who were aged 12 to 15, starting in Wakefield in early October. And at the moment, we've got programs running in school, and children's parents and carers can also book online or go to a walk-in vaccination site, and they're still doing that in large numbers. We know that lots of first and second doses are being given at the moment to children in this age group who unfortunately had an infection in school earlier in the year, and they have to wait 12 weeks before they have the vaccination, but they're now able to come forward and get that. So we have, I think we're close to 60% of our 12 to 15-year-olds now have had at least their first dose, which is really, really good uptake in Wakefield. And at the moment, some children who are in the 5 to 11 age group are also able to get vaccinated. At the moment, we're prioritising children who have a condition that means that they're at risk of getting seriously ill if they do catch COVID. So this is usually a child who's living with a long-term condition, such as perhaps type 1 diabetes, or one of the more serious types of asthma. We're also offering a vaccination to these young people if they live with someone who has a weakened immune system, because it obviously then helps to protect their family member, and it reduces a lot of the anxiety that families have around maybe a child is going off to school and then coming home and bringing an infection home into the household. And if a child is in this age group at the moment who is eligible, they will be contacted by a local NHS service. So it'll either be their GP or their hospital who contacts them. And there's a link there on the slide to all of the information that's available on the Wakefield CCG website about the different clinics that we've got running across Wakefield. It's got lots of information about walk-in clinics, but also about the places where you can book an appointment and go and get your jab. Okay, so that's the people who are currently eligible. It's pretty much everyone over the age of 12, and then some 5 to 11-year-olds who, for a clinical risk reason, have been prioritised and they're having their jabs now. If we could have the next slide, please, I'll talk a little bit about the next steps for the programme. So at the beginning of last week, there were a national announcement about JCVI advice. So that's the Joint Council for Vaccination and Immunisation, about their advice for who needs to be vaccinated going forward and what the programme looks like, certainly for the rest of this year. So this was presented at the same time as the Living with COVID, and it's very much about balancing the protection that we get from vaccination with the other things that we can do to stay safe and to keep our communities and families safe. So where we are now is all the people who were on that slide that I just talked about, they continue to be eligible. So at whatever stage they are in their progress to getting fully vaccinated, whether they haven't had a vaccination at all, or whether they need their second dose, or whether they're now due a booster, they're able to continue to come and access an offer at one of the different sites across Wakefield and get that completely free of charge to make sure that they are fully protected. And we know many people who are coming forward now have either changed their mind. We still have well over 100 people a week in Wakefield typically who've never had a vaccination before for COVID and who've decided that they want to have it done. So people are coming forward because they haven't been vaccinated or because they've still got some outstanding doses. And we don't want people to feel that because the risk of infections probably falling now, that it's not a good idea for them to continue to come forward and complete your course. It really makes sense to get fully vaccinated. What's coming next is 2 changes. So in April, in early April, possibly as early as the 1st of April, depending on the dates that appointments are published, we're going to be extending access to vaccination to all children who are over the age of 5. So that's children who don't have underlying health conditions. It's a very safe vaccination. It will be delivered in settings like community pharmacies and also in our community vaccination centre service in the centre of Wakefield. And then a few appointments may be available through GPs as well. And 5 to 11s are being given a lower dose. They call it a paediatric dose of vaccine. So it's tailored to the size of their body, but they do mount a good immune response when they have that vaccination. So we've already got parents getting in contact and saying, I'm really keen to get my child vaccinated. And the messaging is that we'll start to push information out through things like text messaging and also information on social media channels like Facebook when people are able to book to come and get their vaccination for 5 to 11s. It is a vaccination with an 8-week interval between doses, and you do need to get a second dose if you're 5 to 11 to get your full immunity developed. The other thing that I think everyone was expecting might come is we've been asked to give a spring booster, and it's specifically for the really high risk cohorts who were vaccinated often in late September, early October last year. So it's quite a long time since they last had a booster or last had a dose. And it's those who are over 75, people of any age who are in a care home, so care home residents, and anybody who is immunosuppressed. So immunosuppression is where your immune system may not mount a good defense when you have a vaccination, and therefore you have a booster at more frequent intervals. That's a smaller number than the number of people who were boosted in the winter, because the focus is on looking at what the science tells us about people's waning immunity. So the group that we've been asked to vaccinate by the JCVI, by the Joint Committee on Vaccination and Immunisation, is the group whose immunity is possibly waning enough for us to justify giving them a booster now. What we're now planning for the autumn, and it feels weird to be talking about autumn when we're only just getting to the end of winter, is from probably mid-September, starting to roll out a vaccination programme, which is a wider group of boosters. And At the moment, we've been asked to plan as a minimum to do everybody who's aged over 65 or for some reason is in a clinically vulnerable position. So they have an underlying health condition that puts them at risk. So that will be similar to the programme that started up in September of the winter just gone. It may be that we're asked actually to vaccinate to a slightly younger cohort as well, those over 50, and we'll certainly have a contingency plan ready if we're asked to do that, when we will have capacity to do that. But yeah, so there's 2 rounds of boosters coming up. There's a special spring booster for the most elderly, people who are in care homes and who are immunosuppressed, so that's quite a small group in Wakefield. And then there's a much bigger booster programme planned for the autumn. And the plan for the autumn will be, wherever possible, we will give people their flu jab at the same time as their COVID jab to make it easy for services and to make it easy for individuals to pick that up. What I haven't put on this slide, but I do need to just assure people is, we don't know what COVID's going to throw at us next. So we didn't know, it was very difficult to tell what Omicron was going to be like. You know, we could see we'd got this really, really infectious variant of the virus, and it was a real big unknown, and we pushed out, we accelerated and did a fantastic job of doing a lot of vaccinations in a short period of time to give people protection. We don't know what the next variant will look like, and we really hope there isn't another variant, and that if there is, that it's that each one gets progressively less severe and makes fewer and fewer people, seriously ill. However, we can't guarantee that at this point. And so what we always have to have in Wakefield in our back pocket is a plan for how actually we step back up and respond if there is a risky variant out there. So I don't want people to feel concerned. I'm not forewarning you that we're aware that there is anything out there that's coming up, but we are ready if there is something that comes up. We will be able to stand up extra services and get people through quickly if we're asked to do a lot more boosters than we currently think is appropriate for the risk profile of COVID at the moment. So I hadn't put that on the slide, but I just want to reassure you that we are ready if we need to rise to the challenge again and do another mass vaccination programme. Thank you.
Fabulous, thank you, Sarah. Does anyone have any questions for Sarah?
Tracy, it's Steve.
Yeah.
Just wanted to add a couple of things just to Sarah's words really around variants, and whilst we know that living with COVID has stopped a lot of the response to things like testing and tracing and isolation and guidance, I just want to reassure people that there's still a lot of work going on nationally and internationally to sequence all the genetic code of the virus. We are exceptionally good at doing that in this country, and South Africa are brilliant, and I think it's Holland and Belgium are also really good. So there's a lot of national and international surveillance. So we will be able to spot anything if a new variant comes along. We'll be able to see it. We're not just putting our heads in the sand and ignoring it. There's a lot of work in the background, but that will hopefully reassure people that we can, if we do need to stand back up, then we'll be able to do that.
Fabulous, thank you. I've got a couple of questions for you, Sarah. You mentioned earlier that around about 100 people a week were coming forward who had not previously had a vaccine. Do we know why those people are coming forward, just so that we can tailor our communications? If it's about going on holiday, for example, that we can perhaps ask our comms team if they can ensure that messages like that are put forward?
Many people it is because they want to go on holiday and they are feeling that they weren't too concerned about being seriously ill previously, but equally they're not that worried about the effect on them of having the vaccine. So they've decided on balance they're going to now have to have the vaccine. So they're kind of maybe a bit grumbling about it, but they think it makes sense, and we're very, very happy to vaccinate in that circumstance. There's another group of people, I think, who often they've needed to come at a time perhaps it was quiet and had to have a conversation with somebody because they've got concerns that they want to discuss, and we're always ready to talk to people about their worries about the vaccine. And ideally we reassure people that some of the misinformation, frankly, that is spread on social media has not helped over time. Some people have kind of got a fixed idea, and it's only when they actually talk to somebody who's working in the vaccine program every day and sees the huge numbers of people who've been safely vaccinated it's taken them being able to have that quiet conversation before they've then decided to take up the offer. I mean, we typically at a time, for example, Christmas, people will often maybe talk to their wider family and listen to their wider family's concerns if they get ill, and then maybe their family will talk them around a little bit. So we do tend to see that we get a pattern where maybe people will come forward, as happened in late January. People were coming forward 2 weeks before half term because they wanted to travel at half term. We're expecting there'll be something similar before Easter when people typically go away. And then we'll get another influx of people who've maybe met up with family and friends at Easter, and everybody else is vaccinated, and they said, you know what, it's about time, I'm going to go get my vaccine. So yeah, there's really mixed reasons why people are coming forward. One of the sort of special groups that I might just mention here is people who are pregnant or who've recently had a baby. They are at higher risk if they catch COVID, unfortunately, and we're always encouraging people to reconsider if their risk is changing. And it's one of the points that we've been asked to make by JCVI. We need to make sure that at the point somebody moves into maybe a higher risk group, because they've fallen pregnant or because maybe they're starting a new medication or a course of treatment that's going to affect their immunity, it's remembering that they might maybe need more regular boosters. It's moving them into that slightly higher risk group and making sure that they're keeping up with the vaccinations that they need. So yeah, there's lots of different reasons why people come forward, and I have to say, we do think there are a few people who they literally have to fall over someone with a needle, and then it just becomes convenient, and then they'll go in. And we found this at the weekend. We were vaccinating at the Rhubarb Festival, and lots of people said, well, this is convenient, I'm passing, I'll just have my jab. And then they got on with their day. And that's absolutely what the kind of service that we want to be able to offer people wherever we can.
Wow, that's really interesting. Thank you for that. And then my final question, because I'm sure our colleagues in Carers Wakefield will be thinking, when you mentioned about planning for the autumn boosters for those over 65 or at risk, would that include carers who live with somebody at risk? Because I know our carers raised concerns early doors, didn't they, about being worried about the people they were caring for?
Our expectation is at the moment that it would be, if you think back to the original cohorts that we worked down through, carers are in one of those higher cohorts, and that they would be included, yeah. But it's highly likely that the call order will actually follow the order in which people got vaccinated at the beginning of this winter that we've just gone through. So it will be people who are immunosuppressed, then the most elderly, people in care homes and the housebound, and then moving down through the slightly younger age groups into the over 60s, and then potentially into the over 50s. And I think carers were vaccinated at the same time as those in the over 65 category in the winter that's just gone. So maybe people would have been vaccinated in October. But they should expect, if they count on to 5 months from when they were vaccinated, they're probably going to be the people that they serve or the people that they work with who are in that group will get their booster in the summer, but they'll probably come around the same time in the autumn that's coming. So a carer might expect, if they were vaccinated in October last year, to be vaccinated in October this year.
Thank you. Cute cat, by the way. We've also got a message in the chat. Sarah, you mentioned residents of care homes. Would this include people with learning disabilities?
I believe so, yes. So I don't think it's just adult age care homes. We are responding at the moment to some guidance that came out on Thursday, and we've told there are some more operational notes that are also coming out this week. But at the moment, my understanding is, yes, it would include people in residential homes for those with learning disabilities. I think it's on the basis that you have a cluster of people, many of whom are vulnerable, and it makes sense to do the whole. It's like having a big household, isn't it?
Yeah, I get that. Thank you very much. Do we have any more questions for Sarah? If not, we'll move on, because I am conscious we've got quite a few more slides. So thank you ever so much, Sarah, for that. That was really
I'll stay
interesting.
around for a little while, but I do need to drop off in about 10 minutes. Thanks.
That's fine. If people do have questions for you, Sarah, they're welcome to email in and we'll forward them to you and get a response.
Always happy to help. Thank you.
Thank you very much. Much appreciated. So now we've got George from our lovely communications team. Over to you, George.
Good afternoon, everybody. So I thought it might be beneficial to do kind of a roundup to make everyone aware of what the situation is now that we've had the announcement by the Prime Minister on the 21st of February. So the situation is that all restrictions have ended now. All legal restrictions are now over. And these are the kind of headlines that are on screen. There's some more on the next slide I'll get to in a moment. So most education settings, not all, but most, there's an end to twice weekly tests. It's no longer required. The main thing to come out of the end of restrictions is the lifting of self-isolation. So if you're positive now, you don't have to isolate by law. But that said, it's now guidance that you do so on an advisory basis. So you should still, if you're positive, be isolating for 5 days and then testing afterwards to see if you are then negative in the same way as you would have been. It's just that it's not a matter of law and you're not going to be fined for isolating, but it's a matter now of taking personal responsibility and using common sense in terms of isolating. Anyone like I say, anyone that's positive should isolate for 5 days and take a test. Fully vaccinated contacts of those that are positive don't have to take a test now, but they are advised to, in the same way, to test for 7 days, just to make sure that they've not caught the virus. And then if we can move to the next slide. So unvaccinated people don't have to isolate now, but they are advised to take a test for 7 days. And then contact tracing has ended. That ended on the 24th. Anyone who was positive prior to the 24th can still apply for the test and trace payments. They can still claim up until the 24th if they were positive. However, the payments have now ended. The support payments have now ended. They also ended on the 24th. Okay, so next slide. And this is what's going to be happening in the coming weeks. So statutory sick pay and employment and support allowance will end on the 24th of March. So there will be no payments for those benefits if you catch COVID, and they will revert back to how they were prior to the pandemic happening. So statutory sick pay, you will have to speak to your employer and you will become eligible in the same way as prior to when COVID happened. So the other thing that's happening is on the 1st of April, this will be when all free testing ends. So it will then revert to private provision and you will have to pay for your tests. There are some groups that will continue to receive free testing. NHS staff, for instance, they'll continue to receive free testing. Those in the most at-risk groups as well, they'll continue to receive free testing. The COVID pass that was brought in to gain access to venues and for travel, that will no longer be recommended. It will just be there for use for travel purposes, for international travel purposes if needed. The employers who have had to do a separate risk assessment to do with COVID, that will end on the 1st of April. There'll be no longer a requirement to do that. And also the working safely guidance will be replaced. There'll be new public health guidance coming out on after the 1st of April. Okay, so next slide. So just to sum up then, so all restrictions have ended and all guidance is now advisory and recommended. And we can see here the main things that we're recommending people continue to do. So as Sarah was discussing, it's really important you get your vaccine. You know, it's one of the most important things you can do to just in the fight against COVID is to get your vaccine. If you are unwell, it's a matter of staying at home. It's a matter of using your common sense that just like any other illness, you would stay away from people and you would isolate yourself away, just like if you got flu or any other illness, so that you don't pass it on to other people. It's a matter of hand hygiene is still really important. That's a really effective way of making sure you don't catch the virus yourself and spread it. And then we're still recommending that you wear face coverings when you're indoors and when you're on public transport, you know, to be mindful of people that may be more vulnerable, you know, that would benefit from you wearing a face covering. So even though it's not law anymore, it's just, you know, it's kind, it's caring, and it's supportive of your community to do that. We also are continuing to recommend, because COVID rates are still high, that it's best to meet outdoors, where it's less likely that you're going to catch and spread the virus. Okay, so that's the end of the slides. I just wanted to add something that I didn't manage to prepare slides for, just about what the future is for the communications team. So now what we're doing is we're moving towards a recovery phase. We've been conducting some insight with businesses to get an understanding of how they're feeling about COVID and how it's affected them. We've just received that information through. We did a survey, and we're looking into that. We're trying to understand what it means for us, and we're going to be planning communications around that and around recovery. And we're also continuing for now with the Be Kind campaign that I presented on in a previous meeting. Okay, so that's everything from me, and if there's any questions.
Thank you very much. Do I have any questions for George? There's nothing in the chat. I can't see any hands up, and I am conscious that we've got quite a bit to do and we're running out of time. So if you do have any questions, please feel free to send them and we will respond. Thank you very much, George.
Thank you.
And now we've got Janet Watson from Livewell. Hi, Janet.
Hello, hi there, everyone. I just wanted to present a few slides on things that we've learned from the interface with clients who are living with post-COVID symptoms, so people who are living 12 weeks plus, still experiencing symptoms, and just to give an overview for anyone that isn't aware already of what support is still there from Livewell Wakefield and will be there ongoing. So just briefly to talk about that. So I don't know if everybody is aware, we've presented at a previous meeting, but you may not have seen that, but we offer single workshops. So they support people, particularly who are managing symptoms. So ongoing symptoms after COVID. So things such as pain, joint pain, muscle pain people are experiencing, breathlessness, fatigue, brain fog, other things that go with fatigue, which are quite disabling symptoms that people have really struggled with. And also a 6-week course, so a longer course for people who are able to attend that, 12 sessions over 6 weeks. So it explores much more than the single workshops, which are more symptom based. So the course is more looking at the impact that COVID has had on people's lives and trying to support them in their recovery with a self-management focus, a supported self-management. The course, we knew that the course was there and that it would be good. We know it works for people who are living with a variety of long-term health conditions, and just the same, it does work well for those who are living with post-COVID symptoms. The feedback's been really good. I can talk a little about that towards the end. I've got a few statements people have made. But particularly the aim is around recovery and to try and support people in that is what we are still aiming for. A recovery phase. So encouraging people to practice a range of tools and techniques that we're offering to manage that impact. So it covers a range of things, difficult emotions, which a lot of people have experienced, things that are common to anyone living with any long-term health issue. I myself live with MS, type 1 diabetes, psoriasis, So I've got several what you might call autoimmune conditions. So my experience for the team is coming from that viewpoint of what it's actually like to live with a long-term health issue. And while we know that post-COVID symptoms may not be forever, it's still quite uncertain as to how people are going to recover, when they'll recover, and the timescales seem to be so variable. So I think it's about trying to encourage people to partially to accept what's happening to them right now, realize that that may not be long term, and look at some of these tools and techniques as managing how they're feeling now, so that they do feel they've got some control back, because that's been one of the overriding impressions that have come from the course, that people have struggled to accept what's happening and to move forward. So we're providing support for people to do that with the tools and techniques that are all evidence-based and that really work quite well as well. Could you have the next slide, please? So thinking about referrals into the service, we do encourage self-referral, so that anyone can contact us via the website. All the information is on there. Everything that we deliver is on there. There's some information about the content. There are also the dates and the times so that people can look and see what fits in with them. You can call us on our office phone. I call people back. All referrals that come into the service, I do contact them personally and have that conversation, because I think that's really important, and that's something that has come back as being a positive experience. So we can actually have a phone call, a discussion about that person's own individual circumstances and how we can help direct them to what we think would help them as well. Well, we do get referrals from System 1, obviously, from GPs and PCNs. We do get a lot of referrals. The majority of ours have been through the post-COVID pathway, through the clinic, and that's been a really successful collaboration between ourselves and the pathway. Next slide, please. So thinking about who has actually benefited, we've actually seen 164 clients who have been through the supported self-management service with Livewell, just for post-COVID support alone. That's in addition to the other work that we were already doing. So that's in the last 8 months, so 164. And as I say, the majority of those, 88 of those, in fact, came from the post-COVID pathway. So we're still keen to encourage people who are out there who may feel that they've not had severe symptoms and have not perhaps even mentioned this to the GP. We want people to come forward through self-referral, through the social media adverts that we put out there. We've had 15 clients who have self-referred, so not a massive amount. So we're still encouraging that. We are commissioned to deliver for anyone who lives in the Wakefield district and who may be on the borders but has a Wakefield GP. So still very much out there, still saying, please come forward. We will be continuing to offer the service, certainly till the end of March 23. Funding is in place for that, to actually extend what we can offer as well, so that we can offer more of what we're already doing. Could I have the next slide, please? Thank you. So what exactly has come out of what we've done? Because it's always important to evaluate what you are doing and see if you are making a difference. We've got lots of qualitative feedback from people telling us how much they've appreciated what they've learned. But when you want to look at something in a bit more quantitative way, it can be quite difficult with self-management. But these are the figures that we did come up with, that we asked people how they felt they were dealing with their health and well-being after having COVID. So we asked them that at the beginning of the course. We scored them as to those that felt they were massively struggling. In other words, they rated themselves as poor for not being able to deal, and that would flag us up to signpost to alternative services. So working closely with IAP services like Turning Point Talking Therapies. Fortunately, there wasn't anyone in that category, but in the not so well category, so people that felt they were struggling, 29% of people felt they were struggling. significantly. 71% surprisingly did feel that they were dealing with their health and well-being fairly well. Nobody felt that they were dealing with things very well, like perhaps they would have done previously, and even with other health conditions that they might already be living with. So if we just look at the next slide, please. So we asked the same questions obviously afterwards, and 60% felt that they were dealing with things well, and the 40% actually were now very well. So I thought that was quite a significant increase really in people's confidence about how they were managing their health on a day-to-day basis. So that was quite significant. Just look at the next slide, please. Thank you. So what have we learned? These are things really that I tried to put together that we've taken from people's opinions, people's fears as well, because there are still a lot of fears out there from those who have lived through COVID and some of whom have been severely affected. I think it's worth mentioning, and I know probably it's something that's been mentioned already in previous meetings that you've had, but that people who are affected by post-COVID symptoms, it isn't proportionate to the severity of their original COVID infection. So it's been suggested that people who actually were less severely ill when they had the COVID infection are going on to develop post-COVID syndrome, or what we used to refer to as long COVID in the public eye, but post-COVID symptoms. So it's not proportionate to that, which is something to be aware of, I think. Does that mean that we are going to be seeing more people with post-COVID symptoms as the months go on? People are still feeling quite isolated in managing the recovery, but things have improved. Access to post-COVID pathway, improved access to chest x-rays, scans, blood tests, etc. has helped with that feeling isolated. I just wanted to mention that there. But people are fearful, I think, of lowering restrictions. I think especially when you've been through something very devastating, which it has been for many people, then there is that natural fear. So it is our role as to make sure that people understand that there is support available, that we will still be here to support them, and that people need to continue following the guidance. People need to keep in check with the government website to get local guidance, and to continue to wear masks in places where they feel vulnerable. And also to, as we said before, it's protecting others, isn't it, as well, so that as a community we can feel protected. I think also we've learned that it's impacted people quite significantly, in some cases financially and socially. Those affected by post-COVID symptoms often have not been supported very well in some workplaces, whereas in others the support's been fantastic. We've encouraged our clients to discuss with their managers and to see that some of these initiatives are part of their wellness and recovery action plan, or their RAP as it's often referred to nowadays, isn't it? So getting people to get managers on board with that, and to see that actually it's everyone's best interests for people to experience self-management techniques, so that they can go back to feeling that they're contributing to the workplace. So in every respect, that's something that we would encourage them to do. As I mentioned earlier when I talked about feeling isolated, that improved access to structured support has been really welcome. I think for GPs, I'm sure it's been difficult in the early days. It's an evolving guideline, isn't it, from NICE as to pathways for supporting clients and patients in their instance. So I think people are recognising that improved access and felt that they're being taken seriously when they're going to GPs discussing how they're feeling weeks and weeks down the line. So that's something that's been appreciated. If we could just look at the next slide, please. Thank you. So what we're still going to continue, offering courses and workshops. They're going to continue online at the moment as group video calls. We haven't made any decisions yet about returning to face-to-face groups, but we are following guidance, and we're working with South West Yorkshire Partnership NHS Foundation Trusts as part of our commissioning. So we have volunteers working with us who are delivering courses and workshops. So we're looking at the evolving guidance on risk assessing for going back into the community. But the idea is it's going to be a blended approach moving forward. So we will still have some online sessions, but we will return to face-to-face as well, because it's evaluated probably, I think the last count evaluated 54% of people preferred online as opposed to community-based, for a multiplicity of reasons, not all because of fear of getting back into the community, but sometimes from their own perspective, that it feels easier and safer and more convenient to attend something from a home setting. We are employing a social prescribing link worker who is going to work specifically for clients who are living with post-COVID symptoms. So that is something additional that we're going to be taking forward with the additional funding, which we're very grateful for. And we really feel that that's going to have a massive impact on helping people who are struggling to navigate what other services might specifically help them, and linking in with employment services as well if there are issues around that. So it's a wraparound service in effect, and that's certainly going to continue until the end of March 23. And then I expect the whole country will be evaluating what's happening, won't it, obviously, as things change and the rates come down, whether or not we'll see that people do make a good recovery and it's not needed. I think that will be the end game, that everybody would hope that post-COVID symptoms will be something that won't be as needed as they are at the moment. Support for that. Do you just look at the last slide, please? Thank you. So thinking about what people have said, I know that's very small and difficult for everybody to read probably, but I think just I'll take a snippet from one or two of them. The feedback's been incredible, and I think for me it's been a very positive and quite a humbling experience being part of that. And feeling that I've been able to take this forward, to develop the workshops, to get the support of the people who are attending so that they realise that actually we're learning as well, and to listen to what they're saying, to adapt the information that we're giving according to that, and to make sure that we are moving forward when we do evaluate. So people have said things such as it's been a lifeline, and they've been grateful for that. I think the overriding thing often is that feeling of not being alone. That's been said so many times. Meeting with others who are in similar circumstances can be very empowering. People have said they've found the information valuable, the tools, helping them deal with what they've called their new life, and think about things differently and separately. Some people have said they've felt much more confident in their abilities moving forward, so that they can make more positive changes, and so that they can get the best recovery that they can. And I think that's a key point, that they've kind of now felt that this is me and this is as I am now. I'm no longer searching for that miracle cure, that magic bullet that everybody always wants. I've been there myself. When you're living with a long-term health issue, everyone wants that, but that's not realistic. And I think people have come to learn that from some of the tools that we've used: action planning, problem solving, decision making, all the things that come into day-to-day life that are much more challenging when you're living with health issues. So people have really responded to that really well, which has been great. Someone said it had been like a rescuing me moment in their life. It came at the right time for them. I have followed up with some of them 6 months down the line, post courses, to see if people are still using the tools. They are. I haven't had time to put a slide together for that, unfortunately, but the information just suggests that there's sort of 70–80% of people are still using the 3 core tools in particular, which are setting realistic goals or action planning, problem solving. So when things don't go wrong, what could we do differently? How could we tackle that so that we can face that with more confidence if it happens again? And decision making skills. And I think that will come in as a tool that people can use when they're thinking about returning to life back in the community in this recovery phase that people have been talking about today. Using that decision-making tool. What are the pros? What are the cons? What's the gut feeling? So yes, things that can really help with life. And I talked about the people in the same situation scenario, and that's something that comes through every time, that people really do feel that. When I was in a dark place in 2009 and not working, and I came on one of our courses as a participant, that changed my life. And I hope that I can give some of that positivity to others. And I know that my experience isn't going to be everyone else's, but I know that it isn't just my experience, because I've seen that so many times in other people, and how they've evolved, how they've become empowered after just a 6-week program, which is quite remarkable. People have mentioned specific tools in the feedback and how it's helped them do things in a steady way. Very much focusing on that pacing, that prioritizing, pacing and planning, the 3 Ps, which is vital to recovery. So people have really taken that on board, which has helped. And people have said that they've felt comfortable, which I think is really important, and able to make an honest contribution to the group without thinking that they're being judged, but also not thinking that their experience isn't as valid as someone else's, because maybe they weren't on intensive care or didn't need to be ventilated, etc. So people do have fears around feeling, well, perhaps I'm not as important as someone else, and that's not something that we ever want people to feel. So making people feel valued without feeling judged, feeling empowered. It's just, as I say, been a really been privileged to be part of people's experience and people's, I hate that word journey, but it is very much that for some people. And so it's been a really positive experience, and I'm really grateful that I've had the chance to be part of that and to help develop some of that. It's been lovely, for want of a Yorkshire expression. So I think that came to the end of my slides. Thank you. I think you're on mute, Tracy.
Oh, thank you. I was just saying thank you very much for sharing the slides and for sharing your personal experience too, because that's really important. Thank you very much. And I'm really sorry, I'm a really bad chair, because I'm listening intently to what you're all saying and I've not been watching the clock, and we're way out of time now, but we've got Lisa. Lisa, I'm hoping that you're okay to stay and chat, because people do listen to the video afterwards, listen to the meeting notes after the meeting. So if you can please tell us about post-COVID assessment, that'd be great. Thank you very much.
Okay, I did wonder whether you'd want me to come back or not, or sort of a different time. But you can hear
what do people think? Yeah? What do people think if you've got to leave or whatever? But it's up to you.
If people have to leave, I can come back another time.
What does anybody else think? Can you do a whistle stop tour now and come back again if people want any questions?
I'd rather not, if I'm honest, but I can.
We've got people saying they're happy to stay on. So yeah.
Okay then. No, all it is this is an opportunity for us, really. I mean, I know Janet's just spoken particularly about Livewell and the work that we're doing there, but this is an opportunity for us to really try and raise awareness about post-COVID-19 syndrome. So I'd rather not rush if possible, because it is, you know, we don't get many chances. So I'm Lisa Chandler. Okay, I'm Lisa Chandler. I'm a public health principal, and I'm also a nurse, and I do a lot of work with Wakefield CCG around development pathways and things. And I've just been working with health with both Wakefield CCG and Mid Yorkshire hospitals, and also our colleagues in the voluntary and community sector like Livewell, to develop a really comprehensive, holistic pathway for people who are found to have, or who find themselves to have, post-COVID-19 syndrome. So, but have the first slide up, please. So the thing to say very early on is that for a while, people were not being believed that this was a real thing. And I'm sure lots of you will have seen in the press in 2020 even that people, and on social media, that people are starting to find that they still had symptoms that were going on for a long time. There've been 200 symptoms so far counted as things that can be part of what the people with the condition often call long COVID. Now, I heard Janet say that one of the things is about recovery, and one of the things we're trying not to do is to think about this in negative terms, because the aim is always that you will get better, you will improve, and this isn't a life sentence, if you like. So the symptoms that you see are very varied. That led to people maybe not always being believed, but this whole sort of 200 symptoms are the same symptoms that are seen across the world now. So if there's COVID-19 infections, you will find people who keep having symptoms way past the time you would have expected them to get better. And one of the things I really hope from this all is that people with things like chronic fatigue and ME might also start to be taken a bit more seriously, because we know in the past that those less common viral post-viral conditions, people can often be put down and not believed. So we've got the evidence, we know it's real, and we know it's out there. So that's really important to get across, that this isn't in people's heads, as you said, as maybe being said sometimes. So if you move on to the next slide, please. So the most important bit here from this slide is just to give you some definitions about how we're thinking about long COVID. So long COVID is a term that patients and people living with the condition themselves have said that's what they want to call it. But when you're working in health, that's quite difficult to define exactly what that means. So for some people, it means anything after a couple of weeks, it means anything after 4 weeks, it means anything after 3 months, it might not mean anything that's lasting for longer than 6 months. So what we've got is we've got a definition here. So often you'll hear us calling long COVID, post-COVID-19 syndrome, and that isn't in any way meant to undermine patients or people living with the condition. It's purely about being able to define what we mean by it and how we make sure services are there for people and support is there for people. There has been some work gone on recently, though, asking those living with the condition how long COVID makes them feel, and it is coming out that it feels like it is a lot of something that's going to go on forever and going to go on for ages, and they might not recover from. So there might in the future be some sort of move to try and think of a better way to describe it, but at the moment, that's why we have the two terms, and they're sometimes interchangeable. Next slide, please. So what do we know so far? You don't have to have had a positive test for COVID. A lot of people in the first wave didn't have access to tests. So you don't have to have a positive test. You don't have to have been admitted to hospital. In fact, you might have been really quite well when you were poorly with COVID, if you see what I mean. But you are still at risk of developing the long COVID symptoms after that infection. So we don't look for antibodies. We don't look for anything other than someone saying, I had COVID in June and I'm still not better. I'm still having these problems. We don't want problems to be trivialized either. And we think people might not be coming forward because some of the things that they're experiencing, they're sort of putting up with, really. So there is no other circumstance under which someone loses their sense of taste and smell and we all say, okay, never mind. This, so we still need to have those symptoms taken seriously, even if we think it might be related to some sort of long COVID or post-COVID syndrome. There's help for people available, and we do want people to come forward. For some people, the impact really severe. They can't go to work. They can't look after their family. They can't do all the things they were doing before. They can't sustain employment, and there's a real financial danger to these. Now, given that more people in our deprived areas had COVID in the first place, it's very possible that there's a whole lot of people in those less well-off communities who are really struggling now, and we're just not finding. So we really, really need help to get the message out that if you're still having symptoms, please come forward and let's see if we can help and do something to sort it out. There's also those social impacts around how you are with family and relatives. If you're an unpaid carer, or if you've got a young family, just things like cooking the dinner for your family can be difficult. And we do know there's some cultural barriers to people coming forward because they don't want to admit that, you know, they're struggling, and fatigue is a problem that might be impacting on how they care for their family. Can I have the next slide, please? So at the moment, about 480 people have been referred to the post-COVID assessment service. We think about 500 people have been recorded in primary care, so in your GP's practice, as having symptoms that could be associated with post-COVID-19 syndrome or ongoing symptoms. But if you start to look at some of they call them modelling tools, so people predicting how many people there might be. Now, this one modelling tool, which at the moment isn't taking into consideration the impact of things like vaccination and reinfection and Omicron, which we don't know whether that's going to have the same sort of impact as before. There's evidence that if you've been vaccinated, you're less likely to get long COVID. But all this hasn't been taken into consideration. But there are some estimates that as many as 20,000 people continued to experience symptoms that could be called long COVID. Now, many of those will have already recovered. Most of those will be looking after themselves. But if you even go back to pre-Omicron level, pre-Omicron days, when we were looking at the Delta variant before, there was still around 10,000 people who we thought would have experienced or were experiencing ongoing symptoms, and 2,000 who would require some sort of support through Livewell or through our post-COVID services in the hospital. The other thing is just to say that up until about November last year, there were 300 children thought to be affected, but we haven't found them either. So we really, really, really need help to identify people and to put this into people's minds as, yeah, I'm really tired still, or I'm getting palpitations, or it might not, maybe it is related to that, and coming forward and getting it checked out. Next slide, please. I'm going to move on to the next one because I think there's just like a list of things there. So you can't see this very easily, but what this is it's the pathway for children. So if a child goes to their GP, and we would ask them to go to their GP because it could be something else. So things like fatigue can be a symptom of many things, like depression, cancer, other childhood illnesses. We don't want to miss something because we don't look for it, because we just go straight to, oh, it's long COVID. So first thing is to go to the GP, who will do a proper assessment, and any blood tests or tests that need to be done, they'll then refer into the local hospital. And for any child or young person who symptoms haven't improved in 3 months, will be referred into a hub in Leeds. And that's a post-COVID assessment service specifically for under 16s. Over 16s would all go through the adult pathway, but it's there, and it's there to help them. Next slide, please. So one of the things we're really keen to do is to make sure that there is this information and support for people to work through themselves, and to go to get advice for parents and carers as well. So there's Your COVID Recovery, which I'm sure you've heard me talk about before because I've been before, haven't I? So Your COVID Recovery is online. Anybody who's interested can have a look at that, and it'll tell you all about lots of different things, mindfulness, breathlessness, all sorts of things there that you can have a look at and learn more and help to support yourself. But also for children, in mid-March, the WFI CAN website, which is an information support website for children and young people living in Wakefield, will have a brand new section aimed at helping children and young people manage any symptoms post-COVID that may be impacting on their social, emotional or physical health. The link will take you to loads of self-care tips around things like sleep, because sleep's are often a problem, gentle exercise, how to reduce aches and pains. Children particularly have lots of joint aches and pains, but also increasing your general well-being. There'll be Pilates, sleep tip videos. There'll also be a guided imagery to help with anxiety. And at the end of March, there's also going to be a series of community activities as part of the WFI CAN, where young people can be offered by the school nurse or GP or other health professionals, things like mindfulness sessions, walk and talk mentoring sessions. And there's also a drop in and chat text provision on here. So again, it's about needing to get this message out to people that there's help there. This is where to look. Next slide, please. So this is the adult pathway, which I've shown you before, and I won't work through, but it is about supported self-care at the start and moving through to more specialist support if you need it, through what's called the post-COVID assessment service, which is assessment and treatment. It's therapy-led, so that's a physiotherapist who leads that with special training, who is able to direct people either face-to-face or virtually or on the telephone, whoever they're happiest to do it, and best suits their need, through to a specialist referral. I think the next one, maybe the last slide, Tracy, you'll be relieved to hear. And this is about self-care and support for adults. So again, your COVID recovery is the place to go to start off with. There's a link at the bottom, what can help recovery from COVID-19 on the Wakefield Council site. And these are some of the things that we would, we'd be hoping people would be looking at themselves and the GP would be referring into. So Livewell Wakefield, massive part of that. Turning Point Talking Therapies also have a 6-week course. There isn't a waiting time for any of these services. You can get straight in. At the most, you'll have to wait for the next 6-week course to start. But Turning Point also have some offers. Aspire have offers through exercise on prescription and a specific service for people who have been identified as possibly having long COVID. And finally, there's something called Relax, Breathe and Harmonise. Now, this is a wonderful service that helps to deal with what we call breathing pattern disorders. And what they are is when you're anxious, when you've been unwell, when you've been having problems with breathlessness, you start to breathe in a way that's not helpful. You might have an irregular pattern, or you might not realize, but you're holding your breath, or you're not breathing out properly, and so your airways are always a bit full. What this session does is it helps to teach you to breathe properly again. So it's not about being a choir and singing and all. It is very much about an evidence-based way to help you with your breathing. And we've used this service for COPD in particular, which is this breathing problem that people get when they've been smokers or exposed to coal dust and things. We've used this for many years with them, and the results are simply amazing. So if you promote one thing on here that you might not have known about before today, that Relax, Breathe, Harmonise would be the real sort of take home message. I think that was the last slide, Tracy. So it was quite quick, I hope.
Thank you, Lisa. That was really good. And actually, the posters that you've got on this slide, I don't know if you're able to send them separately, like as picture format, so we can share it on our WhatsApp group and we can send it out to people so they can share it on their social media links as well. Is that possible?
I can try. They don't belong to me. That's the only thing. So the only version I've got of them is a PDF. But that link below, I don't know if you can get the link. Would that be, because all of those things are on that link at the bottom. What can help recovery? So I've got I've got the PDF version. I think we did send one Relax, Breathe, Harmonise that she sent us before, but I'd need to ask because I think one of them's a screenshot off Aspire.
I think that's what I've done in the past when I've struggled. I've done a screenshot and send it out, but we'll try our best anyway and see what we can do.
I can send you what I've got, and the link there will take you to all of it and loads more information as well, videos and all sorts in there.
Yeah, I shall find that then. Thank you very much, Lisa. Do we have any questions for Lisa?
Thanks for having me. I'm sorry.
Thank you very much for coming. No, it's my bad timing. I need
as well. I spoke too much as well. Yeah.
Nobody's talked too much. We just had a lot to say.
Yeah. But again, I would, you know, please, if you come across any of your friends or anything, I'm always on these calls, and as I'm watching people's faces, because I can't see you, but as you're watching people, you sometimes see someone's face just change and they recognize this as being them. So there are a lot, you know, there will be people out there who just don't realize that this is a thing, or don't think this is a thing. And it genuinely is. Anyway.
Or worried they won't be taken seriously, which obviously
don't be taken seriously, or
Yeah, thank you very much. So I can see a lot of people have had to leave, people are dropping out. So once again, apologies, that's my bad. So perhaps we'll leave the gauge in the mood of the community, unless people have got something they'd really like to say about, you know, how are you feeling about it? Are you okay with all the restrictions ending? Are you still feeling worried? Do people have any comments that they'd like us to know about? No? Maybe I can ask that again in an email or in a subsequent meeting, and we'll just see if there's anything we can do, because if there are particular worries or concerns with certain people, we might be able to tailor some of our communications to meet that. Right, we've got somebody, Zoom user, not sure what your name is, but your hand's up. Would you like to ask a question?
I think that's me, Betty.
Yes, hello, Betty.
Hello. Janet and I know one another from years ago, when I did a course with her some 10 years ago or so now. I'm just a bit concerned with the symptoms that post-COVID rises, because they're very similar to fibromyalgia, if not identical, to fibromyalgia and CFS. Now, the pain clinic was overwhelmed before COVID in every area. And it's been very difficult maintaining treatment for us suffering. NHS England has discontinued pain infusions and stuff like that for a lot of people. I just wonder, with this influx, how we're going to maintain it with the health people that we've got now, because it's going, they're already overwhelmed, can't cope, we haven't got enough GPs, we haven't got enough this, that and the other. And I just worry that this new diagnosis, post-COVID, how we're going to cope with it. And it took me years, and I mean years, several doctors to get diagnosed, because I wasn't believed. So I know the battle that they're going to have, and it does debilitate you. And it's just like any progressive illness, it takes your life. You know, with terminal illnesses, we know that that's going to, but with progressive illnesses such as MS and everything else, they do take your life bit by bit. And yes, we can do these courses, and I'm sure that the expert patients that I did years ago and still practice, I'm sure that has helped me maintain the way I am now and go into volunteer work, which helps as well. But I just wonder how we're going to cope with it. I had to go to a rheumatologist to be properly diagnosed. But I understand you just go now and say, I've got post-COVID, no antibody tests and all that. So I just wonder how the health system is going to cope.
Can I come in on that one? Because I agree completely with your experience. I know that experience of not being believed. And during the talk, I did say that I'm really hoping that this experience is actually going to help people with CF and ME. I really hope that it means they'll be taken more seriously, sort of going forward. And I do see that as an opportunity for everybody there. So there has been quite a bit of investment, and at the moment for post-COVID syndrome, it's a diagnosis of exclusion, as many of these things are, because there isn't a blood test at the moment, although there might be in the future. There isn't, because we you know, there's things coming through all the time, and we are seeing that there are some markers in bloods and things that might indicate that you have post-COVID. There is investment in the NHS. Lots of money doesn't always mean that things will be better, because there's not always lots of people, but the pathway is there. And for post-COVID, people are seen at the moment, they're being seen within 2 weeks. Now that doesn't help. I'm sorry, so that doesn't help with your experience, but I do hope that going forward, it will help. And again, with post-COVID, we don't know yet how long you'll have it for. So unlike you know, people with CF and ME who often go on or do go on to have it as a lifetime illness. We're still very positive that post-COVID will get better and return to normal or as near as normal after a period of time. But that this is all putting an increased strain on all services, and that's why we really want to make sure that we take every opportunity we can for people. So a whole pathway focused across the sort of everything that you can do yourself, all the things we know work for you, like the singing group, and as well as the therapists and others, which does include neurologists, rheumatologists, cardiologists, respiratory physicians, urologists and psychologists as part of that big MDT meeting that you get through the post-COVID assessment service. So they are all being pulled in there to talk and to look at patients. I hope that helps.
It does, and I think you've raised some points that I didn't make very clear, but I'm still wondering, you know, with our symptoms, that those of us that have been diagnosed, we are ongoing, and the symptoms of post-COVID are so similar. There's no crossover. They're so similar that I just worry that they, you know, hopefully they don't suffer in years to come, but it looks like they might. And musculoskeletal is also one of the departments that are involved with CFS and that, as well as the neurologists and everything, because of the, you know, your joints, your joints, your muscles, everything. But what I was saying was that we've already had NHS England stop the infusions and stop other things that were helping us, and we've had to go to other things. I just worry what will be available for the post-COVID, because we're getting cut down. You know, what is available to them? Will they bring things back? Will they invent new things? It's a problem. They do need, it's all right saying come forward, but you've got to be able to look after them when they do. And I just worry about this, you know, that we haven't got enough.
Yeah, I do recognise that. I mean, the thing is, we need them to come forward, and the support we're giving them at the moment is based on, there's no bullet, there's no sort of quick fix, as Janet said. It is very much about managing the symptoms, tried and tested therapies, particularly around fatigue and how to manage your fatigue. We've increased capacity in some of those things, but at the moment, the main hope is research. And again, I hope that research will benefit more widely, because as you say, the two are very similar. And we've also got to be careful that we don't just badge everybody as post-COVID, because there will be people with ME and CF and other conditions after a virus that we need to make sure that we don't just badge everyone the same. But at the moment, if you have those symptoms, you can go to that clinic and you will be seen at that clinic, and they will manage the symptoms and they will consult with the wider medical teams, which include all of those ologies and everything else, to make sure that they've got the diagnosis correct, and if there's anything else they need to consider. But I do understand, I do recognise what you're saying about numbers. But at the moment, we've probably not even found a quarter of the people who we could help if they came forward.
Well, this is what worries me. You can be a statistic, but that doesn't help you. You can come forward, but then again, when you're suffering like this with fatigue, you are not at your best to get yourself up and out to become one of those numbers. I think that the people that are suffering the worst are the ones you're not hearing from, because you have so many days in bed.
Agree completely that we're not hearing from people. So yeah, just agree completely.
Yeah, it's a bit of a problem, isn't it?
Absolutely, Betty, it is, and I understand entirely what you're saying, but I think what Lisa's saying is we need to reach out to people to explain to them, you know, that if you are still having these symptoms, please do come forward. At the moment, there are things that we can do to support you.
Well, I hope it's an ongoing thing, because at the moment you're restricted by NHS England as what you can offer. So yes, get them coming forward by all means, and because I know what it feels like. do go for and do press. If you get somebody that doesn't believe, you go to another one. And I know that takes more energy, and I know it's more debilitating, but you've got to get that mindset that, you know, I am suffered. I know how I feel. This isn't right for me. And you've got to push it. But I still think that we haven't got as much to offer them as we should be able to. This is the problem. I mean, it's this proverbial pebble in the pond, isn't it, with these illnesses? There's probably another mutant round the corner that in the fortnight's time will rear its ugly head, and then we'll have even more post-COVID. Do you know what I mean? It's just how we deal with it. And I'm glad I'm not the person in charge that has to make these decisions, because I don't know what, even though I'm a sufferer. And this is what a lot of people at the top forget. They really need to talk to us that do suffer and get guidance with us. Do you know what I mean? I'm surprised that we're not contacted on a regular basis.
Can I just say for the post-COVID stuff, we've got patient groups involved, and I go to meetings, national meetings, and there's always patient representation there.
Oh, good.
And that there is always patient representation there, and some of the groups I'm a member of, sort of outside of work things, there are an awful lot of healthcare staff who have this problem. So there's nursing groups and things that also feed into it. So we listen. So there is there's something called Long COVID Kids, which is parents. There's all sorts of other support groups, and they're definitely there talking to people. And the thing with post COVID is there's a whole lot of research going on about what will work and what does work and what works the best. Everything we're doing at the moment has strict outcome reporting things to say, is this helping? And because of that, we'll be able to work out what the best things are to help people moving forward. And I really hope that benefits others, not just those with post-COVID.
Yeah, I think the post-COVID will be the priority, but I hope that what they learn for the post-COVID will be of benefit to us, obviously. I mean, those of us that have been suffering for years, I hope we do get some benefit out of this as well. I think we're sort of second on the list, but that doesn't matter if we get the help eventually. I'm quite happy to wait.
Thank you very much, Betty, for that comment. And actually, we've only got your name as Zoom user, so if you would like to email your details to CCC, which stands for COVID Community Champions, at wakefield.gov.uk, if you would like me to, I can ask Darsha Farmer. She is from the NHS. She's had to leave now because I've gone over time, but she runs the patient participation groups, and she's always really interested to hear about patients' experience and to try and ensure that your voices are heard. So if you would like me to get a response or something back from Darsha from the NHS, please do email. And
First of all, I am on the WhatsApp, and I'm nice. It's good to put your face to your name. And I thought I'd registered, and Darsha and I know one another very well because I'm part of her PPGRN, and
right,
she knows I've got some views. I've been going to the meetings for years, but I had to do it. I had to pull myself together to do it, to be a voice for the others, because I wasn't being listened to. And I felt that I can't do this on my own. I can't run out there in the street and say, listen, you know, we've got this. It's like a cross between ME and MS and that sort of thing. But by being part of a group that you do. But sometimes I do get very frustrated, Tracy.
I can understand.
I'm sorry for that.
I can understand it, but well, it's absolutely true. When you don't feel well, you don't feel that you need to be fighting a system as well as dear. So well done you for coming forward, and thank you very much for being involved with Darsha and her group, and for trying to help other people as well. That's really good. Thank you very much, Betty.
Thank you, Tracy, and thank you, Lisa. I enjoyed your presentation.
Thank you. Nice to speak to you.
And you.
Thank you very much, and I hope that people will be able to watch back the video as well that weren't able to join us today or missed out because they had to leave. So once again, my sincere apologies, but I hope that you found this information all useful. I certainly have, and thank you very much for being involved.
Thank you.
Thank you very much. Hope to see you next time.
Oh, you will. Thank you very much.
Take care. Bye.
Bye, everybody.